Can plaques be stabilized or healed? When it comes to atherosclerotic plaques, the ultimate question is, can we stop them from rupturing, and can they be healed or even reversed? The short answer is yes. Plaques can be stabilized and in some cases partially regressed. But complete cleaning of the arteries is rare. The real goal isn't to erase every plaque, it's to make them harmless by reducing inflammation, improving their structure, strengthening the fibrous cap, and lowering your lipid content, thus preventing its rupture. Think of it like turning a soft, fragile balloon into a solid, stable scar that's much harder to burst. Now, regarding medical interventions that are scientifically proven in plaque regression, number one, we're having statins. Statins are the most well-studied drugs for plaque stabilization. They don't just lower LDL cholesterol, but they also reduce inflammation inside plaques and thicken the protective fibrous cap, making rupture less likely. According to the ASTEROID Trial in 2006, they studied patients on high-dose rosuvastatin. Intravascular ultrasound IVUS showed measurable regression of plaque volume. But, a big but, if you're living an unhealthy lifestyle, eating poorly, and not exercising, statins alone can't save you. In my previous case presentation, I shared the story of a diabetic patient with poorly controlled blood sugar who wasn't following a healthy diet or exercising. Despite being on statins and having a low LDL, he still suffered a fatal cardiovascular event. The bottom line, statins alone won't save you. The second scientifically proven medical intervention that helps in plaque regression are PCSK9 inhibitors. They are extremely potent LDL-lowering injections, often used for high-risk patients who can't reach targets with statins alone. According to the GLAGOV Trial in 2016, adding a PCSK9 inhibitor to statin therapy resulted in modest but measurable plaque regression. The third medical intervention that we're having is bempedoic acid. This is an oral LDL-lowering drug especially useful for statin-intolerant patients. To be fair, there is limited direct evidence that bempedoic acid causes plaque regression, but there is a compelling case study supporting it. According to a single notable case study, used serial CT coronary angiography to follow a statin-intolerant patient on bempedoic acid monotherapy. Over 20 months, the low attenuation soft plaque core shrank significantly, and the lesion appeared more stable. While intriguing, this is just one patient, so it's not enough to draw firm conclusions. However, according to clinical outcome evidence, the CLEAR Outcomes trial, published in the New England Journal of Medicine in 2023, showed that bempedoic acid significantly reduced LDL, lowered hsCRP, a good marker of inflammation which we covered in detail in our previous episode, and decreased the risk of major cardiovascular events in over 13,000 statin-intolerant patients. These benefits strongly suggest positive effects on plaque health and stability, even if large-scale imaging trials confirming plaque regression are still lacking. One of the most fascinating studies on plaque regression is the HEADS trial, standing for the HDL Atherosclerosis Treatment Study, published in the New England Journal of Medicine in 2001. In this trial, patients with coronary artery disease and low HDL cholesterol were treated with a combination of simvastatin, a statin, and niacin, also known as nicotinic acid or vitamin B3. After just 3 years, imaging with coronary angiography showed something remarkable. Plaque volume actually decreased in the treatment group. LDL levels dropped by about 42%, while HDL rose by 26%. Most importantly, the treatment group had a 90% reduction in cardiovascular events compared to placebo. This trial demonstrated that with the right intervention, lowering LDL, raising HDL, and reducing inflammation, plaques don't just stabilize, they can actually shrink. So the key takeaway in this section, we may not always be able to make plaques disappear completely, but with the right therapies, we can transform these plaques from unstable, rupture-prone time bombs into stable, calcified scars that are far less likely to cause a heart attack. Thank you for watching. Before you go, please consider subscribing, as 75% of our total watch time hours comes from non-subscribers. Your support helps us reach more people and helps us creating more content just like this. And if you'd like to learn more about this topic, please watch the full video right over here.